Good afternoon. I'm back this afternoon to provide an update about the situation, and I know we were here earlier this morning. And it's about our plans, in particular, to conduct increased testing of young people in the Summerside area, but also an update on the situation. This morning, I provided information about 5 new cases of COVID-19 in P.E.I. in the last 48 hours. 2 cases in females in the Charlottetown area linked to travel within Atlantic Canada. Yesterday, we announced 3 additional cases of COVID-19 in the Summerside area, all males in their 20s, with no identified link to travel. Just before I came here, we found out about 1 additional individual who has tested positive, a female in her 20s. And contact tracing and our discussion is just underway, but it does not appear to be directly related to the cases either in Charlottetown or the cases in Summerside. In relation to the Summerside cases, contact tracing continues, and in addition to the 39 close contacts identified yesterday evening, 22 more close contacts have been identified today for a total of 61. Thank you to individuals who continue to contact public health to advise us they may also have been close contacts as a result of attending a fitness facility in Summerside. I will repeat some of the requests I made this morning. Anyone who was at the Iron Haven Gym in Summerside between 6 and 8 p.m. on Saturday, February 20th, and 6 and 8 p.m. on Tuesday, February 23rd are considered close contacts. So if you were at the Iron Haven Gym at these times and have not yet received a call from public health, please immediately begin self-isolating, be tested, and remain in self-isolation, and help us by identifying yourself by calling 1-800-958-6400. The testing clinics in Western P.E.I., including the one at Slemon Park, have been busy today. Testing is ongoing as the clinics are open until 8 p.m. As of 3 p.m., approximately 800 tests have been collected across the province. Many more test results will be available this evening and early tomorrow morning. We now have a total of 7 active cases in the province. There are a number of public notifications, including 1 additional one that I will add from this morning. Anyone who is at the following locations should immediately self-isolate and be tested for COVID-19. Following an initial negative test, individuals should monitor themselves closely for symptoms and isolate and be tested if they develop any symptoms of COVID-19. Individuals at these locations need to be vigilant and monitor themselves closely after an initial negative test. They include the breakfast spot in Summerside, Saturday, February 20th, between 7 a.m. and 2:30 p.m., and Domino's Pizza in Summerside on Wednesday, February 17th, between 10 a.m. and 6 p.m., Thursday, February 18th, between 4 and 11 p.m., Friday, February 19th, between 11 a.m. and 6:30 p.m., Saturday, February 20th, between 10 a.m. and 6 p.m., Sunday, February 21st, between 4 p.m. and 1 a.m., and Tuesday, February 23rd, between 5 and 1 a.m., and finally Wednesday, February 24th, between 11 a.m. and 6 p.m. Individuals who had pizza delivered from Domino's during these times do not need to be tested unless they are symptomatic. Individuals who are close contacts of a positive case, meaning they had contact with infectious individuals, and all close contacts are required to be tested and self-isolate for 14 days after their last contact with a positive case, regardless of their test results. And this includes people in households, in work, who are working in the same environment, and fitness facilities because they have a higher risk of outbreaks and close contact. Individuals who are potentially exposed are those who may have been in an area or building with that infectious individual. And in the case of a potential exposure, individuals are asked to self-isolate until they have a negative test and then monitor themselves closely for symptoms of COVID-19. And that's really what we talk about, the close contact versus more casual contact. As I indicated earlier, our focus is on testing. Testing is key to identifying the prevalence of COVID-19 in our province. With the leadership and support of Health P.E.I. and the provincial laboratory, targeted testing will be offered in Summerside for young people aged 14 to 29, regardless if they have symptoms or not. Anyone with symptoms should continue to seek testing at the Slemon Park Clinic. The clinic will be open between 8 a.m. and 4 p.m. tomorrow, and they will have additional staff available to meet any increased demand. Beginning tomorrow, Saturday, I recommend that asymptomatic people, those individuals even without symptoms, young people aged 14 to 21 in the Summerside area be tested at Three Oaks High School. Those born between January 1st and June 30th should present to be tested between 8 a.m. and 2 p.m. And those with birthdays between July 1st and December 31st can be tested between 2 p.m. and 8 p.m. On Sunday, it is recommended that asymptomatic young people, those without symptoms, aged 22 to 29 years of age in the Summerside area, be tested at the Three Oaks High School. Those born again between January 1st and June 30th will be tested between 8 a.m. and 2 p.m. And those with birthdays between July 1st and December 31st should present for testing between 2 p.m. and 8 p.m. Increased testing will tell us if COVID-19 is circulating in the 14 to 29-year-old age group in the Summerside area. For anyone needing testing in the Summerside area today, the clinic at Slemon Park is open until 8 p.m. and a pop-up clinic at Harborview Medical Center is also open until 8 p.m. And I will mention in terms of public exposures, the most recent public exposure to add is at Taste of India in Charlottetown. And those who may have been at the restaurant on Saturday, the 20th, from 4 p.m. till 10 p.m., Sunday from 4 p.m. till 9 p.m., Monday from 3 p.m. till 9 p.m., and Tuesday from 10:30 a.m. till 3:30 in the afternoon, are advised to get tested and wait for a negative test result. And then after that, if they have a negative test result, certainly monitor closely for symptoms. We certainly have concerns about possible community spread in P.E.I., and this is why we are focused on increased testing. I am worried. We are going to await test results on our close contacts of the cases overnight and early tomorrow morning, and we will be back as early as possible tomorrow to give a further update. As always, our focus will be on our ability to identify and then contain the spread of this virus. Self-isolation, early identification of cases, contact tracing, and the quarantine of cases and their contacts remain really important. And we will be completing, and I know the team is working very hard on the contact tracing of these cases. And a reminder that Islanders who have any symptoms of COVID-19 should be tested, and they should not attend work or public events if they have any symptoms. And as I said this morning, when we have elevated levels of concern, it is when more than ever we need to be patient and kind to each other. And I'll leave it there, and I'll open it up for any questions. Thank you.
Julian Lecachere, Radio Canada.
Docteur Morrison, je vous ai demandé ce matin si on parlait de transmission communautaire. Vous m'avez dit c'est trop tôt pour le dire. Est-ce que là, ce soir, c'est officiel? On a une transmission communautaire à l'île du Prince-Édouard?
Je pense, bonjour, je pense même réponse parce qu'on est quand même en train de parler au cas, mais je m'inquiète qu'on a la transmission communautaire, mais j'attends encore un peu plus de résultats qui va, j'espère, arriver ce soir.
Docteur Morrison, vous avez dit ce matin, il y a des locations, des endroits à Summerside. Là maintenant, vous parlez de Charlottetown. Ça veut dire qu'il y a des inquiétudes pour les deux principales villes de l'île du Prince-Édouard?
Parce que je viens juste d'avoir l'appel avant d'arriver ici à propos du cas ici à Charlottetown. Je ne sais pas encore si c'est lié pour certains à Summerside. Alors, ça c'est des questions qu'on essaie de trouver s'il y a un lien entre les cas. Alors, mais ça m'inquiète jusqu'au moment qu'on peut savoir plus d'informations.
Merci beaucoup.
Merci.
Louise Martin, CBC.
Hi there. Thank you, Dr. Morrison. I'm wondering about when you might get results back on whether this is any of these cases are variant strains. I know it has to be sent to the lab, and I'm assuming the positive cases have already been sent there.
That's correct. Hi, Louise. So the positive cases have been sent. We have asked for them to be done as quickly as possible. I anticipate we will know early next week or to the middle of the week. So, and I know, for instance, Nova Scotia has also sent off their swabs as well. So for particularly the 2 cases that we announced a couple of days ago, it'll be interesting to see the genetic strain match if that happens.
It's obviously a concern for you. Is this going to be impact schools at all in the Summerside area, given the age group of the targeting testing here?
So we are actually, that's why we're doing the 14 to 21-year-old group in that first day. So those results will be all back on Sunday so that we can help make sure that school is not impacted.
Okay, thank you so much.
You're welcome.
Logan McLean, The Guardian.
Hi, Dr. Morrison. Thank you. I'm wondering if there's any plans for a circuit breaker with these new cases.
I absolutely think we are discussing it and thinking about it, and then and we will be making that decision. We know Halifax area has has just announced that circuit breaker or a sense of that today, and we are just waiting a bit more results that we anticipate coming in overnight, and more information that we'll get from the contact tracing that we'll do in the next few hours. But that is always a possibility to see if we can limit any further spread.
And will that be decided, like, is there a solid line that if it's crossed, okay, we'll go there, or is it kind of figured out as it goes along?
Well, we look at a number of criteria, and it is based on the information that we have at the time and the best evidence we have at the time, and we certainly the test results will influence that decision.
Great, thank you.
Okay, thanks.
Wayne Thibodeau, CBC.
Hi again, Dr. Morrison. Can you help me connect the dots? The Taste of India, is that connected to the one person that you just talked about, the female in her 20s?
Yes, sorry, and I should have probably done that exposure rate at the same time, but yes, that is connected.
Okay, thank you very much. I also wonder if you can talk to me a bit about hockey in Summerside. We saw a notice go out from the Summerside Area Minor Hockey Association that says an entire team was at the gym during the timelines when one of the people who was confirmed to be one of these COVID cases, suspect cases I should say, was there around the same time. I'm just wondering what you can tell us about that situation, because obviously a lot of people in a gym around the same time as someone who, somebody who obviously is isolating at this point in time.
Yes, so we have been getting information from that team, and also we had an environmental health officer go up to the gym and so that we really could have a good understanding of the layout, et cetera. So there is a room off to the side of the gym and connected with a small hallway, apparently, and that's where the team, this one particular team, was working out. So they were not in the same actual area of the gym. We are still recommending that these young players, they're around 10 years of age, get tested, but they will not, once they have a negative test result, they will not need to isolate for the full period of time because they weren't in the same actual area of the gym. But we did not, we certainly weren't sure about that in the earlier today, but that just has been clarified.
Thank you very much, Dr.
You're welcome.
Morrison.
Laurent Rigaud, La Voix.
Bonjour, docteur Morrison. Juste pour confirmer ce que vous avez dit en anglais, la personne que vous avez identifiée aujourd'hui, pourquoi elle a été testée? Est-ce que c'est suite à l'alerte à Summerside ou parce qu'elle avait des symptômes? Est-ce que vous pouvez juste nous expliquer un petit peu plus, s'il vous plaît?
Et puis, bonjour, comme j'ai dit, on vient juste d'en parler, mais avec le cas, mais elle a eu des symptômes il y a 2 jours. Et puis, alors, elle s'est testée à cause des symptômes.
D'accord. Et est-ce que on parle beaucoup, enfin vous êtes interrogé beaucoup sur est-ce qu'on va faire un circuit breaker ou ce genre de choses. Est-ce que c'est possible d'avoir des mesures qui sont différenciées selon l'endroit, c'est-à-dire d'avoir quelque chose uniquement à Summerside ou uniquement à Charlottetown, par exemple?
Il y en a, on parle des fois des circuit breakers géographiques, vraiment juste pour une région, comme ils ont fait vraiment en Nouvelle-Écosse. Mais ça dépend vraiment où on a les contacts. Si on a les contacts partout, et puis ça dépend le mouvement vraiment des gens entre une région et l'autre. Et puis, quand on a fait la décision en avant en décembre, c'était à cause qu'on avait des cas et des contacts qui étaient pas seulement à Charlottetown, mais il y en a partout à l'île du Prince-Édouard. Et puis, c'est une autre raison qu'on regarde ces choses qu'on fait une décision. Et on va en parler avec l'équipe et aussi avec le Premier ministre.
Merci.
OK, merci. Thank you all, and we'll provide an update tomorrow.